So, well, hello, my friends. How are we doing this beautiful, beautiful day? So let's jump right into it, guys. I want to discuss fevers. Why am I discussing fevers when it's late spring, getting ready to be summer in the next month or so? Because with the whole COVID thing, kids aren't in school, daycare is a whole lot. So things have sort of been pushed back. So a lot of the signs and symptoms and other regular colds and fevers and flus that people would normally get, or infants and kids would normally get, is actually being pushed back. And I'm having a lot of questions. People are asking me about fevers and when to take to the hospital, when to give certain medications, and how to treat naturally. So I'm just gonna run down a bunch of stuff. So you might see me looking down a little bit because there's a lot of information I want to go over to make sure you guys understand how you doing, Miss Forrest, how to actually control fevers, how to stay at home, and then when you should actually go to the hospital. And it's going to be very per population we actually I discuss as well. So first thing I want you to understand, guys, is fevers is definitely a sign of some sort of issue going on. It's not always an infection. So I want you guys to really be clear about that. It's not always infections when you actually have a fever. You can have a fever for being dehydrated. You can have a fever for being severely fatigued. Sometimes you can actually have a slight fever just from different allergies as well. But yes, a bacterial, or viral, or parasitic infection is usually the main reason why someone would actually have a fever. So there's different ways to actually control that. And then if we look at sort of like so I'm gonna give the ages, and then I'll give like the sort of medium temperature of what you'll sort of look at and when to sort of go to another step. The other controversy that people always say is like, how long do you allow someone to run a fever? In adults, sometimes you can run a fever for 72 hours, and it's totally fine, especially if it's under 102 degrees or 103 degrees. Realistically, if it's under that and the person's fighting well at home and not dehydrated and things of that sort, you can actually have the person stay at home as an adult. As a child, you want to have the child run the fever from anywhere from 8 to 12 hours, and then you want to start after that try to control it, especially if you're doing all the things to keep them comfortable and hydrated. Hydration is a really big part of this as well. So again, you want to make sure that you're doing all those things. So essentially a child, an infant between 0 and 3 months, if they have a temperature of 100 degrees, period, you want to make sure that you are controlling that fever, in some sort of way, or you're going to go to the ER. And again, that's 0 to 3 months. 3 to 6 months, 102 degrees, and these are both rectal readings as well. If a child has a 102 fever at 3 to 6 months, you want to make sure that, again, you're controlling it, or you can actually take them to the ER or to the urgent care there. Now, 6 months to 24 months is going to be that same 102 reading. However, if there are other signs and symptoms, if the kid is lethargic, having other, crankiness, uncontrollable crying, cramping, you see that they're actually dehydrated, lips are real red and purple or cracked, or even can be, cyanotic, which means like, purple and things of that sort. So to make sure that you actually then are definitely going to have that child go to the ER or urgent care to get some sort of treatment. And the reason why that, because again, a temperature that goes high, that means that the infection can be spreading, or there can be other issues going on inside the body. So again, you want to make sure that you're controlling the fever. Like I said before, in adults, the temperature is 102 or really 103. You can, if you control it at home, it's fine. But again, the studies show that controlling a fever at home in infants and kids up to 8 to 12 hours is totally fine. But again, some parents want to run as soon as the child has a fever. Let's go ahead and run versus trying to control it at home a little bit as well. And I'm gonna give you some tips on how to also do that. So first, I always will start with diet. Why are we going to discuss diet when we talk about how to control fever? So I'm going to tell you why I'm discussing diet. Like I said before, a lot of times what actually happens is the child can be slightly dehydrated, or the infection of virus can actually be a secondary thing to the child having a bad diet. So I'll explain that. So what tends to happen is, we want to like just give food, or we still want to try to feed the child chicken soup and things of that sort, feed the adult chicken soup. But what you want to do really is really about, that's when you want to do like warm broths, and you want to do like parade foods and things of that sort. Why do you want to do that? Studies show that as long as you're giving the child electrolytes, or the adult electrolytes, the child is going to get better faster and more rarely as well. That's why we suggest giving Pedialyte. Pedialyte is nothing more than a bunch of electrolytes put together, and just trying to hydrate the body as much as possible. Micronutrient deficiencies, like I said before, is also a form of dehydration. So you make sure that you're giving it as many micronutrients. And diet, as far as like giving like soups and broths and things like that, is a way to get a lot of micronutrients inside of the body as well. I do not suggest like giving like camel soup and things like that, because they are high in sodium. So like I said, soups and broths, you can make it at home yourself. Make sure you put a lot of ginger and garlic and onions inside of it to make sure it's easier to die. Well, actually, those things actually do help break the fever a little bit more as well. And also they are antiviral and also antibacterial too. And it's a way for, again, to be hydrated in a little bit different way. So it's definitely very, very good. And then there are different recipes. Like I'm not a big Gatorade fan or a Pedialyte fan. I'm a fan of a company called Vitalite. Back in the day, it was called Gluconate. The reason why I love them, they're all natural electrolyte replacing. And you can go to Vitalite.com to actually go get that product. I've been using that product for over 20 plus years. A lot of pro athletes use it and things of that sort. So I want to make sure that you guys understand that portion as well. And again, during this time, you don't want to give fruit juices. The whole giving orange juice during this time, do not give orange juice. What happens is when you give a lot of sugar during this time of fever, you're now depleting the white blood cells. The white blood cells is what actually kills the bacteria, viruses, and also parasites in the body. You are depleting the production of these. So you want to stay away from these fruit juices. So definitely stay away from orange juice. Orange juice is a little bit too late, to give. Because any sort of vitamin C, you should be given through a supplementation, and not give in forms of any sort of fruit juices. You want to give, vegetable juices, like I said, or soups and broths. It's going to be easier for the body to digest, and it's going to give you a more electrolyte balance as well. And then to control the fever, you can also go into, go into essential oils. Now, I'm going to discuss essential oils before I discuss herbs, because herbs is something that I know people wait to hear the whole herbal component. So I'm going to give you essential oils first. Cinnamon bark. Cinnamon bark essential oil, you can even burn that in a diffuser, or you can put that, in a carrier oil and actually rub on the body, around the neck, shoulders, around the chest as well. You can do ginger. You can also do peppermint. Those are circulating, so essentially, if you want more blood circulation to help break the fever, you want to actually sort of increase the body's temperature to help break the fever. We call it diaphoresis. What actually happens is the cinnamon bark is warm, the ginger is warm, the peppermint is actually moving. You want to make sure that you give that, you can rub that into the body, but put it inside of a carrier oil. And that's cinnamon bark, peppermint oil, and also ginger essential oils. Rubophonesis, sorry if I can say the word properly. You also want to give German chamomile, eucalyptus, and also spearmint. Those are cooling if you want to cool the body down. And some of this, guys, parents, you got to understand that when I'm saying different things, is really a matter of how long the child or the adult has had the actual fever as well. Some fevers are acute. Some are chronic, or as you can call, I would say, intermittent. They have a fever for a while, then they'll break it and they'll keep coming back and things of that sort. Or it'll be one that they have had for a low-grade fever for a long amount of time. So there's different types of fevers you can actually have. So essentially, during that chronic one, you want to sort of judge what's really going on with the child and how to really make sure that the child is getting what they need. I'm just giving you ideas. I'm not saying go out and do all these things all at once. What I'm saying is these are some ideas. If you need to break a fever, the cinnamon bark, the actual ginger and peppermint, you can actually do some of that. And if the fever is too high, you want to sort of bring it down. That's when you use the spearmint, eucalyptus, and the German chamomile as well. Those are ways to actually do that. And again, like I said, you can mix a few drops into a carrier oil. Carrier oil is usually like coconut oil or olive oil. Some use jojoba oil, because you don't want to put these directly onto the skin, because some can actually burn the skin if you use it directly on the body as well. So you gotta be very, very careful. And also, as you know, sometimes with fevers you can get rashes, and then again, you don't want to extra irritate the adult or the child by putting something that can actually irritate the skin a little bit more. So just be very, very careful with that. So when I get into the herbs, I want you to understand the reason why we use so many different types of herbs, or there's a possibility for using many different herbs to help with a fever. It's because we got to figure out what caused the fever at the beginning. Was it a bacterial, viral, or a parasitic infection? And how are you going to actually break that? Some you do through diaphoresis, some you actually do by actually increasing the actual body temperature a little bit more, and some you also by cooling the body temperature. So you got to understand the action of these herbs a little bit, and what the properties of them are for. Is one called bone set, or the proper term for it is bone set. It's been used for years and years and years. It's actually called the breaking herb. Basically, it breaks fevers pretty well. So you can actually find that it's been shown to actually it actually increases the body temperature slightly to actually break the actual fever itself. It does not do a lot of anti-inflammatory or antiviral properties. A few there, but it actually does work pretty decent. Catnip is actually one that's been shown to actually help to break fevers and control fevers, and that does have a little bit of an antiviral, antibacterial component to it. But with that, you want to drink plenty of water along with it, because again, it partially does some diaphoresis, which means that it makes you sweat tremendously. Same thing with cinnamon as well. Echinacea, the reason why we throw echinacea in there is because of the fact that we know that echinacea is huge antiviral and also antibacterial. The reason why you put that in there is because of the fact that you want to make sure that you're fighting the viruses as best you can, and that can actually, by killing the virus and bacteria, is going to reduce the fever. Elderflower, not elderberry. Elderberry is next, but elderflower is the flower of the elderberry, and that's been used for years and years and years to break fevers because it's a diuretic. It actually helps you break the fever by making you sweat a whole lot, so it's very, very good for that too. Some people feel uncomfortable sometimes when they actually take that, but it's kind of fine, because you want to sometimes again increase the body temperature to help fight off the infection in the body as well. And then elderberry, as we know, is phenomenal for its antiviral, antibacterial properties. So what's going to happen is you have the elderberry, and it'll start to fight the viruses in your system. And then, again, guys, remember, I'm not giving you doses because of the fact that it's going to be a little bit different. I'll see about that a little bit later. Lemon balm, again, you can drink your lemon balm tea. What it does is it's also a diaphoresis. It also helps you sweat to get everything out. White willow bark. White willow bark it has the components, or this is what aspirin was actually made from. So it actually has the components to actually naturally reduce the fever inside of your body. So it's like an NSAID. It's a COX-2 inhibitor, so it causes the body to actually just lower the body temperature immediately for blood pressure and all the other stuff, but also for fevers as well. So it's really, really good. Yarrow is something that's been used for years, and it does the same thing. It sort of like stops the temperature from actually rising that much. And again, some of these things are designed for kids and some aren't, so I'll get into that a little bit. Also, our virus, and yes, I'm going to mention our virus because it's the reason why I compose this virus. I'll tell you the reason why. It has Kutzo, Linosirium, it has Androsophis, Isatilis, and Forsythia. Okay, so let me explain to you the reason why I compose our virus and virus junior this way. So the whole idea is to actually have part of the herb be able to raise the body temperature, but also you want to also have a cooling effect. So I do have peppermint inside there as well. Also, there are things in there to also help the body do a diaphoresis, so it'll break the fever and also make you sweat, but also it'll reabsorb that liquid, so you won't also feel dehydrated too. So the reason why I compose a virus in such a way was to make sure that I'm able to deal with the viral, able to deal with the bacterial and also parasitic, while not also allowing your body to become dehydrated and making you feel uncomfortable, because also we have things in there for cough as well. So it was a very, very good way to actually do a few things there. Now, diagnosis, or as far as different dosaging, if I can say it properly, for this, the actual different herbs is going to vary per manufacturer you actually use. For all the herbs that I actually listed, so it's going to vary. But essentially, you want to have a company, I always mention this, a company that you actually trust that's going to have a good ratio. Our stuff is between 5-to-1 and also 10-to-1 concentrate. So it's a very, very high concentrate. People always ask as well, it's such a little small bottle. I'm like, it's a high concentrate of herbs inside there. It's not, I give all clinical doses, things that I give to my patients, I give to you guys as well. But all the other ones is going to vary. You know, that's why I try to give you a list of different ones that you guys can try out. And again, it's going to be something that you try here and there, but you also don't want to give all of these all at once. You don't want to, everything on the list, you want to go out and try to buy all of it. And the reason why, because one is a lot of stuff, and two, you don't understand how to use them, properly. One reason why we did create the Ware, or you can go out and get the elderberry, or you can do lemon balm, or you can do just a few here and there. I'm also going to give you guys some homeopathics. I'm real big also into homeopathics. I don't have a homeopathic line myself, but I prescribe a whole lot of homeopathics, especially to infants and also individuals with chronic disease. It's the reason why there's no associated side effects, and also I like the action of them. That's why sometimes I even combine, that with our herbs too, because I do have a few, homeopathics in some of our formulas that's sort of hitting in there here and there. So I love the actions of them. Sulfur is one of those homeopathics that people hear, oh, sulfur, I'm allergic. I say, no, it's a different action to the sulfur. And essentially the reason why it's phenomenal, it helps to really, get the body to get rid of different bacteria and viral infections pretty fast, especially in the gut. It really does that very, very well. Pulsatilla is actually one of the herbs I do actually have inside of Ware as well, but I love the pulsatilla action in here because this is one of the few that actually allows the body to reduce, and it actually is an indication that someone just doesn't feel like eating or drinking a whole lot. This is one of the homeopathics you want to give to them. The belladonna, as everyone really knows, belladonna is like a poisonous plant, but in a homeopathic is actually very, very safe because you're not getting the actual belladonna. But this is what individuals have a really, really intense fever where they're so uncomfortable, it's hard to break the fever. It's been shown to actually reduce it tremendously. What's another? Actinium. Actinium is a remedy that is like at the beginning of when someone says, I'm not really feeling well, you can start giving them like every 20 minutes a dose of the actinium, and it's been shown to actually curb that, and you pretty much won't even have the actual fever. And it is a great antiviral too. So just to recap, guys, you see, I had to take notes with a lot of information because there's a lot of different components here, and I want to make sure that I'm able to address the individuals that have been asking me these questions. So please share this information out to all your groups if you can, because I would love to make sure that they get the information efficiently and effectively. That the age limits that I actually said in there, these are the guidelines from the CDC, the FDA, and things, everyone else. However, I look at those and I say, hey, look, if you got a chronic condition, also be smart about it. However, you can definitely control things at home. You can definitely control things, and don't rush just because someone has a fever. Monitor it, see what's really going on, and then let's be smart about it. If you have to give an OTC, type thing, give it to them, or you can give them the willow bark. Make sure you have the Ware and the Ware Junior on hand all year long. I mean, anytime I travel, I take 2 or 3 bottles of Ware wherever I go, because you never know. As well as try some of the homeopathics, but also remember that when someone's having a viral attack or any sort of fever, do not give them orange juice or any sort of fruit juice. It's going to deplete them a little bit more. People may feel a bit better, but it's not going to really help them out long term. Do a good electrolyte replacement like the Vitalite, or do soups and broths yourself. Do not get the stuff out of cans, because again, it has a lot of sodium inside of it. Be smart about it, and just notice signs and symptoms. In kids, it's going to be like lethargy, a lot of crying, and possibly rashes all over their body. In adults, it can be rashes, and then it can actually speak to you what's really going on. They probably just feel uncomfortable or just feel very, very weak. And just make sure that you start to control it. I'm sorry, guys. That was weird. And with adults, like I said, it can be up to 72 hours. You can have a fever and not have to go to the hospital if you choose not to. But again, if it's something that you want to do, always be kind and courteous to yourself, and be smart about it as well. That's the most important thing. Got a question here. Bottles of what? Sorry, Ware. Ware is our supplement that we have here for viruses and colds and flus and things like that. So they help with fevers, help with fighting any sort of infection like that. We also have Malcare. Malcare was designed for parasitic infections. However, we also also have viral components and also bacterial components inside of it as well. And I have a few case studies with that we've been using with some individuals too. That's been helping out. You can go to our website, healingblends.com, to check that out as well. So guys, thank you so much for joining me. If you have any questions, I'm quite sure you guys are gonna have questions. Like I said before, send this out to your family and friends and also your groups, because I get these questions all the time about what to do when my child has a fever or I have a fever, whatever. There's some very, very easy ways to take care of this, and you don't have to panic. Please don't panic over this. I know a lot of my sickle cell patients, they panic pretty easily if their child has a fever. But it's a matter of just understanding how to control it first and foremost, and then sort of go from there. All right, guys. Thank you so much. Love you guys. And again, like I said before, this was a huge question for individuals that was asking how to control this, and I do my videos based on the question you guys asked. You guys asked some phenomenal questions, so keep the questions coming, and please join me. Actually have a interview tonight. Got an interview tomorrow with Rolling Out magazine, phenomenal magazine about Black health and Black wealth as well. I'm one of the health IQ guys there, so I do every few weeks. I do a segment there. We have so many different summits coming up. Probably in June or July, we're going to have a sickle cell summit where I'm going to have some of the top health experts in this field, along with myself, go over some research we've been doing to show you guys how well you can actually take care of yourself naturally as well. So thank you guys so much. We'll give you all the dates for that stuff, and we'll be talking to you very, very soon. Bye.